All right, Turner Stadium, it's Friday night. That means Doc Talk. I'm Rob Lynch, Gerald McNeil. We're joined here from Memorial Hermann, Dr. Mike Cusick, and we've got Cusick. And we're joined here. We're going to talk a little bit. This is an injury that I've wondered about a lot of times, Dr. Cusick. I've always wondered how baseball guys could hurt their shoulders, and a softball girl can stand out there and pitch 300 pitches and her shoulder never be bothered. We're going to talk tonight about shoulder injuries in different sports, and go ahead and start with that one right there, because that's a mystery to me.
Right, yeah, we a lot of overhead throwing athletes, as you guys are well aware of the pitch count, and we've done a lot better job at keeping track of how many pitches and how we're overthrowing our young athletes at an early age, and that's helped us with a lot of these injuries. But actually we see it a lot more commonly, labral type injuries in overhead throwing athletes, but we also we're starting to see softball players even.
Oh, really?
Yeah, even softball players with an underhand motion will still come in with pain at the end of a release of a fast underhand throw. And so probably some of the same things are in play there, but obviously the overhead thrower is at a higher risk for those types of injuries.
While we're still on baseball, I know Gerald's got some questions about some football quarterbacks, but while we're still on baseball, the World Series is fresh on our mind. We just saw Madison Bumgarner on 2 days rest come and pitch 5 innings. I'm not asking you to tell me if that was right, wrong, or indifferent, but I just want you to tell me, is that how the injuries are caused, or?
So I think that's, you're right. I don't know if that was just adrenaline or what gets that going, but the back-to-back throws, the number of total pitches, and also really throwing mechanics are critical. So anytime that you're getting out lateral away from your body, your arms dropping low, or your forearms getting below the level of your elbow, so your sidearm throwers, if you follow those guys, they will end up with elbow pain and potential shoulder injury. So throwing mechanics are critical.
It's funny you say that about mechanics, and I know how important that is. And you hear people say now that the video camera has changed sports more than anything, and I guess that's right, because you can monitor mechanics in everything, in football, softball, everything.
Yeah, and so we focus, or we've looked in the past at, because you see these incredible pitchers with those low releases, and we just tell at least high school kids early, I mean, those are really fortunate players, and 9 or 10 out of 10 of those low throwers like that are going to have an injury, so we try to change their mechanics early and retrain them to throw properly, so that they don't put so much stress across their elbow.
So it's the torque on that.
The torque across the inside of the elbow when they release from that low release point is sooner or later going to give you a problem, and it's predictable. It's predictable.
It's interesting. I watched the game with my neighbor. He's a pitcher, pro pitcher back in the day, and I asked him. He said the normal rotation was about 5 days. So they would come in, they would throw, and then they'd be off for 24 to 36 hours. But then it was interesting. He said that they would come back and actually throw and warm up in an actual game before they went into their next start. So I always thought that was a little, different.
Yeah.
But he said, just getting in the groove, more than anything, your body got used to that. It was hard to get the body away from it.
Yeah, I mean, and they have obviously, those guys are at the elite level, but certainly for our high school athletes and we really have to monitor their total numbers to avoid some of these, because a lot of them are just overuse injuries.
I do have one question too. Tell me about the strength of the players now, because one interesting thing now is that the size of the guys now, quarterbacks, our pitchers, especially our girls, and I'm an umpire in the girls softball. These girls are big. I'm talking about they are monsters. Do you see that either being a hindrance, does it help them, but they're so strong now? Does that play into some of the motions also?
So I see. I mean, particularly in football, in Texas high school football. I mean, these kids are big, and they're you played, and there were more normal looking athletes that just happened to be athletic, and now these kids are huge. And I think it's certainly, anybody that sits down here on the sideline like we can see the hits that are being delivered out here, and it's dangerous, So yeah, I think that definitely is playing into a part of some of these injuries that we're seeing.
Let me ask you, while we're talking about football, because It used to be a quarterback, both in college, high school, and professional, would throw the ball maybe 10 or 15 times a game. Now they're throwing it 50, sometimes 60 times a game, and sometimes they throw it almost on every down.
Right.
Are you starting to see injuries from the quarterbacks with the shoulder injury?
Yeah, so we've seen a couple of quarterbacks. It's interesting. We see throwing injuries from the quarterbacks as far as like biceps, labral type injuries, but also we see, because all these the push towards the mobile quarterback, see a lot of knee injuries and ankle injuries from quarterbacks rolling out of the pocket and taking hits. And I just saw a kid the other day that had a knee injury rolling out of the pocket and got smoked by
the throwing motion for a quarterback, to me, seems a little bit, we talked about mechanics, but it seems a little bit more awkward if he's on the run, because everybody is moving out of the pocket now. And that motion seems awkward to me, even more so than a pitching motion.
Yeah, and if they're throwing hard across their body back to the other side of the field, that's an awkward throw for them, and it can put their shoulder in it, So, and again, it's mainly repetitions, and like you said, they're throwing more and more often. So they're more at risk for that type of injury.
Is it pretty much the same theory though? The higher, the less one? When you really bring that, when you're kind of snapping those throws?
Yeah, same thing applies. I mean, I think in baseball, because you're just generating such velocity and such torque that you're more prone to that. But sure, if a football player is going through that many motions, we also see a lot of AC injuries, and they come down hard on that shoulder, they get hit by a lineman, and they separate their shoulder. So we see that very commonly.
Let's talk about the curveball in baseball, because that's one question that everybody has, is when do they start throwing the curveball? Well, now kids are 12 years old and they're 6'1", 180 pounds. When do you start saying, okay, it's okay to practice that curveball?
Yeah, so I think that's a good question, and I think it's still that's still the verdict's somewhat out with that. I think that to a certain extent you have to go with what your body feels and how that pitcher's feeling. There were some people that said before your physes, before your growth plates are completely closed, and maybe you should avoid throwing that. I don't know that we have that strong of a stance on that anymore. We certainly want to mix their pitches up and not depend heavily on the curve the younger they are. But I think it's a little bit of feeling out that particular pitcher and seeing how he's tolerating that.
What do you think coming in the near future? Because one thing that I know is true. Our medical technology is vastly improved. So do you see us developing something, whether it's sleeve, and I know they work different things, sleeve, arm, or do you actually see, coming up where they're going to develop something that may kind of, help from some of the injuries, especially when we have young kids. I know we're getting to the pro level, it's a different ballgame, but I'm talking about in high school and leading up to that. Do you think?
I don't know about a protective sleeve per se. I mean, I know we talked before about PRP and some of these other therapies, and those may end up proving to be, and there's some early studies that say those could be really promising. So those may end up really being a critical part of healing some of these overuse type injuries.
What's the newest thing you're seeing right now in shoulder injuries for an athlete? I mean, I know there's the latest and greatest and newest and the best. What's the new thing for treating shoulders? Is there anything out there? Or is it still basically just same old strength and conditioning?
Yeah, so I mean, I think we've gotten a little bit more aggressive about, depending on the type of injury that you have, a mainstay is always going to be physical therapy and strengthening. Biceps, labral type injuries, we're a little bit more aggressive surgically with those these days if they keep nagging an athlete. And of course, shoulder dislocations, we've gotten fairly, pretty much one dislocation, and we'll consider doing something operative for you to stabilize your shoulder.
How is the water and the water aerobics, is that coming along to be a part? I do know that towards the end of my career, we used to get submerged in the water quite a bit. A lot of swimming, and it was a poor swimmer, by the way. So, I mean, that was coming into play. So, are we starting to see some of that?
Yeah, I mean, hydrotherapy is important for athletes, and it offers just an alternative modality for, particularly, again, we use that a lot in lower extremity injuries, or if you're recovering from an ACL or you're recovering from something where you want to work your muscles in a reduced weight environment, so you don't have to put so much weight on your ankle fracture, et cetera. That can be really helpful for that type of stuff.
I can tell you how really, I got to say how dumb we used to be back in 1960s and 70s. Just think about it. You're taking all that weight, you're coming down on that knee, you're trying to get it strong, as opposed to getting in a pool, flotation, putting the vest on, and still working that. And that's some of the things that I said that it was amazing. I'm like, well, golly, I probably did my body a lot worse earlier than I did, towards the end of my career.
Yeah, and we've honed in on the therapy too. It's the specific, very specific things for specific injuries. We've gotten better about what we need to focus on and what we need to get stronger, particularly with things like ACLs. We have a very honed therapy program, and we know exactly where the kid needs to be before they can get back out on the field.
And a high success rate of recovery too.
Yes,
that's the good thing.
Absolutely,
big time.
Absolutely. We're getting better.
Oh, you're getting a lot better.
Getting a whole lot better.
I wish I'd have
Memorial Hermann's getting a lot better. And, what a great partner you guys have been for us here at Texan Live. And let's talk, before we let you go, let's talk one more time because this is one of the favorite things I like to talk about, and that's the thing you guys do on Saturday morning for the kids over at the clinic. Let's talk real quick about that, and we'll let you get out of here. But we really enjoyed with you guys this football season.
Well, we appreciate it. We're happy to be here, and we enjoy getting out here and watching good Texas high school football.
That's great.
So, but yeah, we have our injury clinic, and it's Saturday mornings. It's for a few hours each morning on a Saturday, and the idea when we started it was just to allow parents and kids and players another opportunity to get in and quickly see a doc without having to go to the emergency room.
All insurance is accepted.
All insurance is accepted. You can walk in, and we'll see you even, so initially it was for just that acute injury Friday night, but we'll see anybody that with a sports injury that has a problem during the week, and they, maybe they're busy and they can't get in, so it offers the parents another opportunity.
What a great service by Memorial Hermann. And now let's talk about where it is now, exactly where it is.
Yeah, so it's at it's in our building, our office connected to the Memorial Hermann Northeast Hospital, right off of I-59 on the South Service Road. And so we're in the professional building. It's attached directly to the hospital. We're on the 4th floor, and our doors are open, so anybody can come by that has any sort of sports or athletic injury. We're happy to see them.
That's probably the best program that I've ever heard of, because it's giving knowledge to the parents and the kid, and then the more knowledge you are, the less scared you are.
And it's on a Saturday. They don't have to take off work. They can bring their athlete up there, and it's just a great thing. Dr. Cusick, enjoyed it. We got to get to us some football here tonight, and we appreciate you joining us.
Appreciate it. Thanks.
All right. Thanks a lot.
Thanks.